Lords, I thank the noble Lord Trees, for tabling this debate. The story of tackling NTDs is one of extraordinary progress and collaboration, and there is plenty to celebrate in this space, but as always, still more to do. Earlier this year, I had the opportunity to visit Rwanda and see a mass drugs administration take place in a school. It is not hard to imagine why children whose bodies are infected with parasitic intestinal worms find it difficult to go to school, concentrate in class, and get an education. The children I visited are now free to learn and fulfill their potential. Almost 4.5 million people a year in Rwanda receive treatment for NTDs, and for every one of those children I met, there are millions more stories of lives changed. Across the world, this story of lives changed is multiplied. 1 billion people received treatment for at least one NTD in 2016. These people are now able to see, walk to work, access education, get jobs, and have better lives. The reach of treatment for all NTDs has grown dramatically, freeing more people from disease every year. There has been a 68% reduction in cases of sleeping sickness, and several countries, for example Bangladesh, have significantly reduced the number of new cases of visceral leishmaniasis, and I say it just because I learnt it. In several cases, countries have managed to eliminate diseases entirely. I won't go through the entire list because Lord Trees has already done it. This success is testament to people working together across the world in a coordinated response. Researchers have been developing effective cures and treatments. Pharmaceutical companies have provided the means to fight the diseases. 1.8 billion treatments were donated by pharmaceutical companies in 2016 alone. Targeted funding has been provided by international development agencies and private foundations to train medical professionals and provide help where it is needed. Domestic governments in endemic countries have financed and enabled NTD programs, meaning in 2016, interventions against NTDs were able to take place in over 130 countries. This progress is testament to the extraordinary power of networks and should give heart to any that doubt that large-scale change is possible. I pay tribute to the work of the End Fund, one of the sister charities to the Legatum Institute, of which I declare an interest. They have shown the power of mobilising private philanthropy and what can be achieved by building coalitions to actively identify gaps and opportunities for investment. In 2006, Alan McCormick saw an article in the Financial Times from a professor of tropical parasitology, Alan Fenwick, which explained that for just 50 cents per person, a life could be freed from disease. Alan and the Legatum Group went on to found the End Fund to coordinate and generate the capital that would scale up their response. A decade later, in 2017, they invested in 23 countries to train 345,000 health workers and treat more than 97 million people. They've been chosen to manage the Reaching the Last Mile Fund, which is a 10-year, $100 million fund founded by His Highness the Crown Prince of Abu Dhabi. And it's excellent news that DFID have committed a further $1 million to the fund for 2019, in addition to co-investment with the Bill and Melinda Gates Foundation. This partnership has enormous potential, and I hope will lead to greater collaboration beyond 2019. As we celebrate these extraordinary achievements, it must not be forgotten, though, that these are diseases that affect the world's poorest and most vulnerable countries and trap them in cycles of poverty. These are not diseases that are rife in wealthy communities, but thrive where conditions are symptomatic of severe poverty. As Margaret Chan, the former Director General of the WHO, said, all of these diseases thrive under conditions of poverty and filth. They tend to cluster together in places where housing is substandard, drinking water is unsafe, sanitation is poor, access to healthcare is limited or non-existent, and insect vectors are constant household and agricultural companions. An effective response is not just one, therefore, which treats these diseases themselves, but a strategy to invest in raising the prosperity of communities and nations where these diseases are rife. More than 70% of countries and territories that report the presence of neglected tropical diseases are low-income or lower middle-income economies. We must be investing to break the cycle of poverty that NTDs are a part of. I ask the Minister to expand on what the government is doing through our Commonwealth and other relationships to ensure that this is a priority at the highest level of government in endemic countries. The targets set in 2012 were ambitious, and to meet them, more work must be done to reach the remaining 1.5 billion people affected. The role of DFID investing in eliminating neglected tropical diseases is a genuine success story, and we have a proud history as a nation of contributing to this fight. I therefore call upon the Minister to comment on how we will commit to see this fight through right to the end.
Yeah.